Thank you for attending our session, The Ethnic Differences in Health and Cardiovascular Risk Factors of Asians in Arizona. There are 21 million Asian Americans in the United States. They are the second fastest growing racial ethnic group in the West. Arizona experienced the second largest population increase at 95%, following Nevada at 116% in 2010. The Arizona Department of Health and Human Services generates an annual births report. However, they combine the Asian Americans and Pacific Islander health data due to small sample size. The lack of granular health data conceals the current state of health, and there's very limited research on the health effects of perceived discrimination among Asian and Asian Americans. Granular data is required to develop targeted interventions, support research-based public health policy, and advancement of health equity research. The aims of our study were to describe the perceived health state, differences in healthcare experiences based on perceived racism, healthcare barriers, preventative health practices, and cardiovascular risk profiles of Asian Americans in Arizona, and to identify the predictors of hypertension and diabetes type 2. A cross-sectional descriptive secondary analysis was conducted using 2013 through 2017 births data sets. Births is a randomized telephonic survey of non-institutionalized adults 18 years and older to ascertain their self-reported general health, health behaviors, health conditions, and preventative practices. Skip logic was conducted. As a result, 2014 and 2016 data sets were eliminated due to significant missing variables. Data sets 2013, 15, and 2017 were used for this study, as a total of 492 Asian Americans were included for this study. Descriptive statistics were utilized, and logistic regression analysis were also used to identify the predictors of hypertension and diabetes type 2. Based on our analysis, more than half were male, with a mean age of 45.06. Close to 62% of the responders were married. 66.5% of Asian Americans were college graduates or graduated from tech school. However, Filipinos had the highest percentage of not graduating from high school. Close to 49% of Asian Americans earned greater than $75,000 yearly, while 20.5% of Asian Americans had income below the federal poverty level, which is defined as less than $25,000. It was highest among other Asians, followed by Filipinos and Japanese. And almost 91% of Asian Americans described their health as being good, very good, and excellent, while 4.5% of Filipinos described their health being poor. Asian Americans and other Asians reported that their experiences was worse than other races, and that physical symptoms and being emotionally upset based on how they were treated because of their race. Regarding healthcare barriers and preventative health practices, about 12.5% of other Asians and close to 12.5% of Filipinos had no health insurance, and 32.4% Chinese and 28% of other Asians had no personal health care provider as their usual source of care. And close to 17% of Filipinos were unable to see healthcare provider due to healthcare costs. And about 37.6% and 36.2% of other Asians had no preventative health checkups within 12 months. When we look at the CVD risk factors, Japanese had the highest prevalence of hypertension, followed by Filipinos. Filipinos had more than twice the rate of diabetes and being obese when using the World Health Standard BMI cut-off point when compared to the total Asian Americans. And smoking prevalence were highest among other Asians, followed by Japanese and Filipinos. And that 22.6% of Asian Americans met the CDC aerobic and strengthening physical activity guideline. When we look at the predictors of hypertension and diabetes, being 45 years and older, you were 3 times more likely to have hypertension. It was significant at 0.01. Being obese, using the Asian BMI cutoff point of 27 kilograms per meter squared, and the World Health Organization BMI cutoff point, you were 2 to 4 times more likely to develop hypertension than those that were non-obese. And the lack of health insurance and the lack of a personal healthcare provider as the usual place of care were strongly associated with not having diagnosis of hypertension. And health checkup greater than 12 months was associated with not having the diagnosis of hypertension. When we look at the predictors of diabetes, again, being 45 years and older, you were 6 times more likely to have diabetes. Adults who were obese, again, using the Asian and the World Health BMI cutoff point, it was again a significant predictor, resulting in more than 2 to 3 times more likely to have diabetes. The inability to see a healthcare provider due to medical costs was associated with higher odds of developing diabetes by more than 3 times. And health checkup greater than 12 months was a substantial predictor of not having a diagnosis of diabetes. Our findings from this study were compared to available Arizona Burfess reports in Healthy People 2020 leading health indicators to gauge the state and the national progress in achieving health parity. Almost 21% of Asian Americans live at poverty level, higher than the all US Asian Americans and non-Hispanic white. Filipinos and Japanese have the highest shares of poverty level when compared to national data. The Asian Indian subgroup, although had superior in their level of education and income level, reported physical and emotional symptoms based on their perceived racism. And the lack of health insurance was higher among Asian Americans when compared to US Asian Americans and non-Hispanic white. The inability to seek healthcare due to cost was lower among Asian Americans compared to Arizona. However, it was highest among Filipinos at 16.9%. Close to 27% of Asian Americans had at least one healthcare provider as the usual source of care, which was lower than the rate among Arizonans. Close to 32% of Asian Americans had preventive health visits greater than 12 months, slightly lower when compared to Arizonans. The smoking prevalence among Asian Americans was slightly lower than Arizonans, and when using the Healthy People 2020 data at 12%. Almost 23% of Asian Americans met both the CDC aerobic and strengthening physical activity guideline, which is slightly under Arizonans at 29.3%. When we look at the daily fruits and vegetable consumption among Asian Americans, it was slightly lower at 3.5 versus 3.6 among Arizonans. In conclusion, based on our knowledge, our study is the first to characterize ethnic differences in health, healthcare barriers, healthcare experiences, preventative practice, and CVD risk profiles of major Asian American subgroups in Arizona. Based on our findings, Asian American subgroups in Arizona are vulnerable population. Few results illustrated some progress towards achieving health parity, such as with smoking prevalence. There are differences in the social determinants of health, healthcare barriers, preventative practice, and CVD risk factors. There are also variations in their healthcare experiences based on perceived racism, even with opposite socioeconomic factors in income and education. We identify strong association between hypertension and diabetes with non-modifiable and modifiable health risk behaviors, preventative practice, and healthcare barriers. The health profiles of Filipinos depicted morbid state when compared to other Asian American subgroups, when compared to Arizonans and national data. Based on our findings, There is a call to action to utilize granular data to develop, implement culturally appropriate, evidence-based interventions based on the specific Asian American subgroup learning preferences while applying the principles of community-based participatory research. Again, thank you for taking time to listen to our presentation. If you have any questions, please do not hesitate to email me. Thank you.